Magda and Alison, would you like to start?
Yes, I think we can. Alison?
Very good. Let's hit the road.
Oh, here we go.
So
On the bike.
Nice. Thank you for the agenda. So good afternoon, all. Thank you and welcome to the third annual Western Mass Public Policy Forum. This is hosted by MOAR, the Mass Recovery, and organized by a great group of people.
Have everyone mute their phones, please.
Yes, please mute. Everyone who's not talking, please mute.
Are we good? Can you hear me better now?
I can hear you better. Thank you.
So I was saying that today's event is organized in a partnership with the Association of Behavioral Health, the Hampton County Addiction Task Force, Quebec Health Substance Use Alliance, the Western Mass Substance Addictions Providers Association.
We've mentioned that on every call, and over the past few months, there's been a steady increase, I would say, in those follow-up rates.
Oops.
At the current moment,
We're hearing somebody's telephone conversation.
Yes. So I might just go over them.
Mary Ann, you can mute everyone.
Can mute everyone.
Please mute.
Whoever's hosting, please mute everyone.
Are we all muted now? I think so.
Yeah, I think so. I have power here.
Okay, so I was talking about who's the people organizing this event. We have our partnership was the Association for Behavioral Health, the Hampton County Addiction Task Force, or HCAT, Quebec Health Substance Use Alliance, Western Mass Substance Addiction Providers Association, or WMSAPA. I think I said it right. Parent Support Group of Western Mass, Learn to Cope, area peer recovery support centers, like Hope for Holyoke, there's support center in Springfield, and there's another one in Ware. And all Western Mass coalitions, we have kind of gathered together and collaborated with our resources to have today's event. I will say who I am. My name is Magda Cologne, and I'm part of the Hampton County DA's Community Safety and Outreach Unit. Together with Alison Proctor, we are the co-chair of the Hampton County Addiction Task Force. So about today's event, in addition to our elected officials, we're joined by representatives of the support, prevention, and treatment and recovery committees of Western Mass to really listen to the most up-to-date information on how issues of addictions in the era of COVID-19 are being taken care of at all levels, and share some of the experiences from those who are working on the front lines. But before we get to our agenda, I would like to take a minute to thank you and thank you all. Thank you all for your time today, and thank you for all you do every day to save lives. Now more than ever during these unprecedented times, you have acted swiftly, creatively, and unwaveringly, using technology available, determined to reach out to those who are in need, literally where they're at, offering telehealth, online support groups, mobile services to all those that need it. Especially I talk about that partnership between Bay State and Tapestry Health that are just providing people the services that they need where they are, like literally with a van where they are. And so during today's agenda, we're going to hear a little bit more about what we're doing in our community. As friends once told me, when you can't do what you do, you do what you can. And today I'd like to thank all of you for doing what you can and doing it consistently and strongly and helping others. So without further ado, I will continue with the I'd like to introduce our agenda with introducing our DA today, Hampton County District Attorney.
No, I just did it there. It's easier.
He might have to unmute himself, DA Galuni and Magda.
I'm there.
Very good. Excellent.
Thank you. It is me. It is not some evil imposter with an awful beard. This is a temporary thing, I promise, of obviously the pandemic and some laziness from being home so much. But with that behind us, I want to thank everyone sincerely for being and joining with us today. I guess this is the best we can do. Wish it were in person. I really hope everybody is well and everyone's family is well and everyone is enduring these extraordinary circumstances as best as possible. But thank you for joining us. I want to thank MOAR, of course, first and foremost, for really joining with HCAT to put this forum together. I want to thank all the participants. And I really want to thank our first responders, those of you who are in healthcare, for the work you're doing to save people, to help people get us through this pandemic. But I want to thank you all for continuing, as I know you are, the hard work on the issue of substance use disorders, on helping our communities, helping individuals who need the help, even during this pandemic. I think the pandemic has dominated the news, it's dominated all our minds, and it's changed our lifestyles. But there's still great need, as we well know, people suffering and dealing with substance use disorder that you're still providing. You're enduring, you're fighting for them, and I appreciate that. And I promise you that the Hampton County Addiction Task Force and the work the Hampton District Attorney's Office is doing will continue. I'm really looking forward to getting back into the swing of things, as I'm sure all of you are, and getting back to work face-to-face on the ground on the issue of substance use disorder in our counties, in our communities, and helping the people we know so desperately need our help. But again, I thank you for continuing the work. I know many of you are doing everything you can to support your clients, to support people in need, electronically, by technology, making phone calls. It's not ideal, but you're still doing the work of helping people and saving lives, and I'm so appreciative for that. I thank you. I think with those comments, we're going to begin the agenda, but we're going to hear from my dear friend and my colleague, Hampton Sheriff Nick Kochi, who has also joined us. Sheriff Kochi, the floor is yours.
Well, good afternoon, everybody. It's great to be here with you, and District Attorney, thank you, and thank you for your leadership on this committee. And if you'd like, I'd be more than happy to pony up some money to buy you a razor, so we can
I knew
get
that was coming.
You know, I'm just jealous. Okay, I'm jealous, 100%. But no, I do want to just echo the DA's sentiments, is thanking MOAR for putting this on, Magda and Alison for their leadership with HCAT and all of our first responders. And I just wanted to talk quickly about some of the things the Sheriff's Office has been dealing with over the pandemic. And, you know, when we talk about COVID-19, you know, we're talking about what we're faced with today. But there's an epidemic that was ravaging our communities here in Hampton County and across the country prior to the pandemic. And that was substance abuse disorders. And that was the overdose and deaths when it came to all of our Section 35s and all the work being done, and the DA starting a drug court and looking at the opioid epidemic. So I think it's important that we have this meeting today, and we remember, we sit back and remember that as we're dealing with the pandemic, we still have the epidemic that is ravaging our communities, and there are still deaths daily due to opioid overdose in misuse, along with other substance abuse uses. So, you know, with these COVID-19 and the releases from the SJC ruling, I just want you to know that the DA and myself have been very vocal about trying to do the right thing, trying to put people back to the community that are going to be productive and do so in a safe manner and have the resources at their fingertips to be successful. Unfortunately, I have to report out that there's been at least 3 to 5 deaths of substance use disorder individuals who have left custody throughout the Commonwealth just out of the county sheriff's offices. And I say 3 to 5 because we're waiting on the last 2 to be confirmed that they were from the offices, but that's 3 to 5 too many. Those were preventable. And when I say they're preventable, they were preventable because the services being provided inside the houses of corrections at that point, and especially here in Hampton County, where we haven't had a positive case inside of our population, those services were being rendered on a continuous basis every day. One of the struggles we're having with our aftercare and our all-inclusive support services agency is that when we're trying to put people back to the community, if they come directly from our house to the agency, they'll accept them. SJC is asking us to release them. We release them. The minute they hit the street, the minute they touch foot on the grounds of the street, they're no longer being accepted into several support service agencies in the community because now they're considered a community entrance or an entry, and they're not tested for COVID-19, and they could potentially infect so many of the people that are receiving care in those particular halfway houses or wherever they may be at that time. And that's understandable. So how can we collectively together get partnership to where we are putting people still in much needed housing atmospheres where they can continue to focus outside of the facility, maintain their sobriety, maintain some level of going to their AA, NA meetings, their mental health appointments, as well as their healthcare appointments. How can we get that to all happen, even with the pandemic of COVID-19? Because that's where I have sleepless nights. I won't speak for the DA, but I know he's had them. We have sleepless nights because these are people that we care about, that we're trying to continue to help and support, get ready to go to the community. And quite frankly, they're being shot-putted out there, and there's no one there to catch them. And I struggle with that every day. I'm not saying jail's the place for everybody. What I'm saying is right now, your county sheriff in Hampton County and your county DA have the best interest in mind of anyone coming in through the courts that are inside the facilities and being asked to be released from the facilities. We have their best interest in mind. And I think I'm asking how we can better support and help each other to make sure that nobody falls through the cracks. One life passing is one too many. And unfortunately, the data that we're getting isn't overwhelmingly positive for the people we're putting back into the community based on a quick Supreme Judicial Court ruling in the Commonwealth of Massachusetts to get them out of our custody. So this isn't a political topic. It shouldn't be. It's about life safety. It's about helping people get prepared to go back onto the next journey, which is life after incarceration. A lot of these folks are with us. 94% of them have a substance use disorder. So anybody leaving, regardless of their crimes, they still have an element of substance use disorder. And they have to then succeed and navigate when they go back to the community. During time of COVID-19, anxiety levels are up. During times of COVID-19, employments are down. How are you going to afford to pay your rent if you don't have a job? You can't collect unemployment because you don't have a job. So it's just, I'm asking you to help us or help the sheriff's office navigate a better way and a better system in getting people from our custody back to the community with better and more strong safety nets underneath them. So if they do relapse, if they do slip and fall, if they do fall, we can get them back on track without having the ultimate incident be a senseless loss of life. And that bothers me. It bothers me. I know it bothers you. And I don't think this is a time to play political football with should they be in jail, should they not be in jail, should they go to court, should they not go to court. We'll leave that for the courts. But what we should be talking about is we have decisions that have to be made, and how can we make the best decision for the person in front of us? And that takes time. It takes individual review of cases, and it takes people to trust, and I'm preaching to the choir here, to trust their district attorney, to trust their county sheriff and their staff to do what's best for the people in our care and custody, getting them back out to you folks in your agencies so they can succeed and not recidivate, not come back, and ultimately, at the worst end of the spectrum, perish because they couldn't support their addiction. So I'll get off my soapbox there, and I want to thank you all for taking the time to chime in today, listen, and hopefully come together and develop some level of programming that can better suit the people that we're bringing back to the community. Thank you, District Attorney.
Thank you very much, Sheriff Kochi. So as Magda had mentioned earlier, I'm Alison Proctor, Research Specialist for the Hampton County Sheriff's Department, and I also co-chair HCAT. And so at this time, I just wanted to introduce Sidra Calvert, the Bureau for Substance Addiction Services with the Massachusetts Department of Public Health, and she's the director there. Sidra?
Hi, thank you so much for having me. I'm also incredibly grateful to Marianne and to MOAR for allowing me to speak again about what the Bureau of Substance Addiction Services is doing and what we're seeing. It was really inspiring to hear Sheriff Kochi. I've heard so much about you the last 15 months I've been at BSAS, so it's really nice to actually see your face. So thank you so much. So I want you
to know you're the first person ever to say they were happy to see my face. Okay, but thank you.
I'm an incredibly polite person. So I wanted to specific, and I also wanted to state that we have several BSAS representatives on the phone, and also, as many of you know, Ruth Jacobson Hardy, who is our representative. I also have a cat that is just dying to get on camera, so I apologize. She's distracting me. We have Ruth Jacobson Hardy, who's our regional manager for the western part of the state, who is incredibly knowledgeable. So if I misstate or miss something, she will absolutely 100% jump in and do that. So as folks know, I just wanted to give a broad perspective of what BSAS has done during the COVID-19 pandemic. Some of them are state regulations that we were allowed to change. Some of them are federal. And I heard Tom Coder was on the phone, so he might be able to speak specifically to the SAMHSA piece. But a couple of the things that we were really excited and happy to do is that we went through our entire regulations and looked at where we could loosen our regulations and barriers to treatment to allow for flexible and nimble care within the spectrum of services. So that included levels of care, from a detox level to a residential level, to be able to flex their space to meet the need. So if a lower level of care, such as a less structured level of care, such as a TSS, a transitional level, or a residential, they could flex their space to accommodate more people, which without the 30 or 60-day licensure, things of that nature. For the outpatient treatment program, or excuse me, for the opiate treatment programs, our methadone clinics, I'm trying really hard not to speak in acronyms too. We were given the federal government gave us blanket waivers to do, to increase take-homes, 28 take-home methadone bottles for folks who are considered stable, and 14 take-home bottles for those who are considered not stable. And that would be somebody who's sporadically still using, maybe housing unstable and things like that. We would have loved to do more. The discretion of giving those take-home doses were at the discretion of the medical director. So we could give them the tools and then they had to use them. Some were amazing and some were still incredibly restrictive. Telehealth, which is also something that we've been able to utilize. We've seen no-show rates plummet, to places. I'm hearing that they have 5% no-show rates, which is unheard of in some places. So the telehealth has really been a spectacular addition. We have not heard that the federal government is pulling these back yet. I was on a call with SAMHSA on Friday, and there was no date set, but we should know that these eventually will probably go away. We are still looking at keeping our state regulations as they make sense, waived in certain instances. Trying to think, those are the big ones that we've done statewide. Some kind of notes for the western part of the state. We have fewer numbers of COVID positive reported than in other regions. We have a few programs where people are getting support. And we do have some programs that have been able to create isolation and quarantine programs. a special shout out to the Western Mass BHN, who has actually been able to continue to admit people that are COVID positive for their ATS and CSS. That's their detox level of care and their step down from there. That's huge, because what we were finding is that programs across the Commonwealth were not allowing folks who were not already known or in their system to be admitted. So we had people who still needed detox or another level of care who were not being able to be admitted if they were COVID positive. So bravo to BHM for really stepping up, and the programs also in the Boston area who were able to do that. Let's see, for the Western Mass, I'm just trying to think. Ruth would like me to also make sure that all of these places that were really instrumental, Franklin Opiate Task Force, Hampshire Hope, Healing Communities at Work in Holyoke, Hampton County Addiction Task Force, in Berkshire Opioid Overdose Prevention Coalition, and the Western Mass Substance Use Disorders Provider Association really got a shout out for their continued collaboration. The last thing that I forgot to mention that BSAS did, and I'm talking really fast, I'm also a middle child, so I have to get all the information out as fast as I can before my siblings would talk over me. That is that we were very instrumental in allowing, providing substance use guidance for the COVID positive homeless hotels. They were called the Isolation and Recovery Support Hotels. When we got involved, there was no accommodations for people who are still actively using, which we were advocating for. We wanted these folks to be able to access these hotels to distance themselves from other folks in the homeless population, but who were maybe not willing to stop drinking or using substances, that they deserved a place to go and convalesce as much as anybody else, and to ensure people who were in treatment could go with their methadone or their buprenorphine, and making sure that they had access to the treatments that they needed. And I know that there was one in Pittsfield. I want to say there was one in maybe Northampton, and then several other across the state. So I'll stop there and then take any questions if people have anything about BSAS. And I think I hit all of Marianne's requested topics.
Right. Okay.
Thank you very much, Deidre. And if you do have a question, please feel free to put that into the chat box and we can answer that through. I know that we have a lot of various speakers and we do have a question and answer time too, but thank you very much, Deidre. So next I would like to introduce Kirsten Doherty. She's the project director for Speaking Out for Addiction Recovery for SOAR.
Hi, everybody. As Alison said, my name is Kirsten Doherty. I work for MOAR. SOAR is a project of MOAR. It's a grant funded by SAMHSA, and the whole purpose of the SOAR network is to really bring together all the peer recovery support centers funded by BSAS, as well as the other 10 or more recovery community organizations that also exist that are other funded is how I consider them, but to connect them around best practices, sharing information, lessons learned. We bring them together for a boot camp and summit every summer. So it's really been beneficial to have that type of connection so that there's some collaboration and information sharing going on. There are several, not as many as we would like, in Western Mass Peer Recovery Support Center, so I wanted to give a shout out to them. Some of them are on the meeting today, some of them aren't, but there is the Recover Project in Greenfield, Living in Recovery out in Pittsfield. We have Beacon Recovery Community Center, which is North Adams, Northampton Peer Recovery Support Center, Hope for Holyoke, and Springfield Peer Recovery Center, which is new. So I'm really glad to be able to share with you that that these centers exist, and they've been very, very instrumental in still providing services to their members and supports as much as they can. It's been a real challenge, but they've really been able to be supportive and through the use of Zoom and through all other ways to do that. So I'm going to pass it on to Trevi Hall, who is our regional coordinator for Western Mass.
Hey everyone, my name again is Trevi Hall, and I am the Western Mass Regional Coordinator for MOAR. I believe I would be remiss if I didn't mention what MOAR's mission is as far as the recovery community goes. Our mission is to organize recovering individuals, families, and friends into a collective voice to educate the public about the value of recovery from alcohol and other addictions. that is part of my role in Western Mass, is to spread that mission. And we also envision a society where addiction is treated as a significant public health issue, and that recovery is recognized as valuable to our communities. My role here is to work with, mainly to work with the recovery support centers and the four counties that I'm responsible for, to get the information out to them, to organize them, to make sure that Western Mass gets the information as it relates to addiction, recovery, supports, resources, funding, grants, to make sure that Western Mass gets that information basically simultaneously as the rest of the state. So basically that's what I do, and I love my job. All right, now I'm going to introduce a couple of the directors from the peer support centers here in Western Mass. First up, I'm going to introduce Deborah Flynn Gonzalez. She is the director of Hope for Holyoke.
Thank you, Trevi.
You're
Hi,
welcome.
everybody. I'm Debbie Flynn Gonzalez, and I'm the director of Hope for Holyoke Peer Recovery Support Center, a program of Gandara. And what a difference a year makes. Last year, I was at the breakfast forum at the Hall of Fame with a couple of members giving their story. It was a great breakfast, but definitely some changes. So on March 24th, we put up a sign on the gates of Hope for Holyoke, finally, saying Hope for Holyoke is closed until further notice. It was a sad day, and it was a day that just before those days were really rough because we were kind of the last kids on the block. When the McDonald's closed in Holyoke and the Holyoke Public Library, there were people just really lost and looking for places to go to charge their phone, to go to the bathroom, to get something to eat, and to talk about recovery. So in those few weeks before that closing, we really made final pushes and efforts to get people to engage in some kind of recovery, and many people did, which is the good news. But we put up our number, we put up a little plastic thing on the gate with the detox numbers and our Facebook page address, and just kind of just before that mobilized and got our peers who had been doing groups up to speed. Some of them didn't even have a Facebook page. We got them that and got them the technology they needed, and made copies of groups and all of those things so that we could do what we knew inevitably we'd have to do, and that is go completely virtual, which is a big challenge for a program that everything we do is based on social connection. But we jumped right in it, and literally a week later, we were offering 48 groups online on Facebook or Zoom. Everything we had at the center was taking place virtually. We had a buddy system in place where people were calling people, and our phone really to this day has never stopped ringing. Our Facebook page literally within a week went from like 200 followers to 800, and now we have like almost 1,500. It was the growth was just amazing, and we have new members who have come on, many people who weren't able to access recovery supports before because they worked or they had children and they couldn't, and now they are engaging in all sorts of recovery supports, which is a really great thing. But with that, we still knew there was a big vulnerable population that we were not reaching. And those are predominantly in Holyoke, the homeless, which we had long before identified as problematic in the city of Holyoke. And we knew we had to really reach out to them. Even times when we went into the city, people would be kind of roaming around, no face masks, nowhere to go. And there were just some really pretty difficult situations happening with no shelter, and Springfield being somewhat accessible for many people, and an inability to go to Northampton. So they were just kind of in the middle of it. And along with the Healing Communities grant and some other great partners who I'm going to totally shout out, sorry about that. Whoops, My camera just went off. I know you all want to really see me, right? So let's
That's
see
a
if I
nice
get it. There we go.
picture.
Yeah, it is. That was at the Hopi Awards, by the way. So the Tapestry and Holyoke Medical Center and Holyoke Health Center, Elliott Services, and really everyone on Healing Communities, we really quickly started to work on this issue, and just with some kind of low-reaching fruit to say, can we get, you know, a couple of porta potties and sanitizing station? We really need that in Holyoke. And you know, we had tried, and it was kind of slower than we would have liked for sure. And the nice thing that happened was, I think because the peer recovery community is so active, particularly in our community in Holyoke, with just advocacy and on all sorts of different committees and whatnot, that happened to be at the MOAR alcohol town hall, and somebody mentioned to in the question and answer series to Doctor, who was there, about the issue of homelessness in Holyoke, and you know, we don't have any bathrooms and things like that, and you know, and it's not a criticism to the city because they were working on it, but you know, we wanted it yesterday, and it wasn't happening as fast. So Rep Decker had kind of made a mention about our rep, Aaron Vega, who he may be here now. I spoke with him earlier today. He was going to try to get on, but they were in session. But he's really been quite a supporter of everything in the recovery community in Holyoke. And I, you know, had reached out to him, and the next day after that forum, very quickly things moved. And long story short, we now have 2 porta potties, some sanitizing stations, a tent at one of the sites, and all of the partners are kind of together and taking turns and being there and being able to meet people's basic needs. We're getting people into treatment. Friday, we were there at 10 for a couple of hours, and they actually got 3 people into Greenfield for detox. You know, and we have had one person that, you know, I'm going to be very honest, did have an overdose in the porta potty, but somebody was there and they got him out, and the HPD were working very close with as well, and they were really responsive. And you know, that little story, somebody overdosed in that porta potty. Then they went to Holyoke Medical, and our person there called our recovery coach in Holyoke Medical, who was there waiting. They engaged in conversation, and that person ended up in detox that night at Carlson. So I'm pretty convinced that if that had not been there, that person may not be here today, because they would have been in an alley or in an abandoned building. So I'm very eternally grateful to everybody and the partners who came together, and we all just did it in Holyoke with no agenda, with no territorialism, not who's doing what, whose client is whose, but let's just help this vulnerable population. And as we move back in, we know we're going to continue to need more services, we need PPE, we need all of that, but our membership has even grown more, and we know that many of our people who were in sustained recovery have now relapsed, and we're really, you know, on top of that, and know that the recovery support systems are really going to have to be there when we're able to get back in a big way, because, you know, we're the resource that they're looking for. So with that, I thank you very much for having me, and thanks to everyone who's doing this great work.
Thanks, Debbie. Now I'd like to introduce Julie Gagney, who is the director of the Springfield Peer Recovery Support Center.
Hi, everybody. I just, you know, like, Debbie like hit a lot of it on the nail, and thank goodness for Springfield having wonderful supports like Hope for Holyoke to learn from, right? We were a budding new peer recovery center, and we were, you know, our community was just starting to really engage in everything when all this happened. And like Debbie said, you know, we also too had to close our doors on the 24th. And, you know, I have to say we caught the ball, and we got our stuff going as virtual as well. And you know, we've been trying to think outside the box, and our biggest challenge, you know, Springfield has tons of resources to connect people with. So we've been, you know, fortunate in that aspect. But, you know, the thing that I've seen the most is, like Debbie said, even our folks that were in long-term recovery, they lapsed in because this disease, right? It you know, like, it's the scary part about it, the thing that it wants us to disconnect from people. And this is a great way to feed that with the social distancing. And so even though there's so many different services offered online, you know, people were still feeling disconnected and scared. And so we had to think outside the box and try to provide support. So we started doing some outreach in a safe way to be able to provide support to our communities. So even collaborating with Hope for Holyoke and other providers like Tapestry, and just, you know, even bringing our members just little, you know, care packages, showing them support, bringing them information about services they might not know that existed. Also too, you know, making sure that our virtual stuff goes on. The show must go on, you know? And so, you know, and I'm finding that, you know, like this really works. And even though our members have like a couple of them that have, you know, fell, they've been able to pick themselves back up. And I have to give props to everybody that's here that is providers, a part of that community, like recovery coaches and, you know, other providers like that, because they've been able to access those resources. And really, you know, before this happened, you know, like if they were mandated to treatment, they're really working on their own wellness plans now, because they know that, you know, like they got to do this, you know, and I have to say, you know, one of our members, his relationship that he developed with the recovery centers really helped him when he experienced his lapse. And he had able to pick himself back up, get reconnected with his recovery coach, you know, access virtual services through AdCare, and really develop a wellness plan so he wouldn't end up back into the system. And I have to say he's really doing well, and he's maintaining regular contact, you know, and so like there's a, you know, that's one of our main challenges. I think another thing that I want to touch on is that through this whole experience, I really encouraged our peer leaders and the team at Springfield Peer Recovery Center to tap into like some of the programming that's going on, the webinars and the different services that are offered, the different trainings around COVID-19 and peer support work. Because like I keep on saying, like after this, everybody's gonna be in recovery. So like, it's really good for, you know, I wanna make sure that legislators and everybody knows that, you know, COVID-19 is gonna be the, you know, like everybody's gonna wanna, but we can't forget, like, you know, Sheriff Coachy says about, you know, we already had stuff going on. And so like hoping that we continue our momentum with the recovery services, because we really need these things and more so than ever. So yeah, thank you for letting me share about Springfield's progress, and you guys have a wonderful day.
Wow.
Kirsten?
All right.
Okay.
Thank you, Trevi. Thank you so much.
Yeah, thank you.
Yes,
Thank
and
you.
thank you, Kirsten. And Kirsten, did you want to add some more?
You know, I just wanted also to recognize that, you know, with the peer recovery support centers, that, you know, there are folks out there in communities that are, you know, doing the work on the ground and trying to open up the peer recovery support center. And I wanted to acknowledge them. One is Where they're trying to start a peer recovery support center there. We work with Gail Grammarosa and other folks from her coalition. And then I just noticed that a gentleman in Great Barrington and his group are trying to start a peer recovery support center. And so really glad to see that. And we're very supportive at SOAR Network and as MOAR, trying to support those folks that are trying to get these peer recovery support centers started. So glad to have you guys with us.
It's very, very exciting to see the growth of the recovery centers across Massachusetts. And we owe a lot to the Bureau of Substance Addiction Services to make this happen. Julia Ojeda, who is the Recovery Support Services Director, is absolutely wonderful. And thank you to Calvert. And the state legislators were so helpful, because they voted the money in and they listened to the advocacy, which is really, really wonderful. So we're hoping one more time it will happen again. And speaking of legislators, we have one coming up right now, and that is Senator Ann Goby, who represents Worcester, Hampton, Hampshire, and Middlesex District. So Senator Goby, take it away.
Well, thank you. That was a very nice introduction, Marianne. Nice to see everyone. And Kirsten, I'm glad you brought up about where in the recovery center and the work that Gail and Nika and those folks are doing. And I really appreciate the support that you've given as well, because we've kind of felt we were sort of a desert there, if you will, and those type of services are needed so much. I guess just a couple things. Always good as well to see Sheriff Coachy and hear about the wonderful things that are going on. I jumped on a little bit late, so I apologize for that. I missed the DA. Typically this week, had everything been normal, so to speak, the Senate budget would have come out, and we would have been getting ready for a Senate budget debate next week. Obviously, that has not happened. The House has not done a budget yet. And until really we get a better idea of what sort of federal funds might be coming in, we are really relying on what may come out of the House. We're really thrilled to have someone like Congressman Neal, who is helping to write and being the lead writer of that document that will come out of the U.S. House. We're hoping that there are some good things for all of Massachusetts, and we really need that. Just to kind of give you the ugly part of it, we're going to be looking at about a $5 billion deficit for going into fiscal year 2021. And just to put that in a little bit of perspective, for those of you who are around and working in this field back in 2009, 2010, we had that last big recession. That was about a $4 billion deficit, but that was spread over 2 years. This is $5 billion hit in year one. And it's not going to be pretty. I don't know what to tell you right now, what the budget will look like. I'm expecting that we'll have to use up, if not all of the rainy day fund money that we have that's in stabilization. That'll go like that, especially if we don't get enough support from the federal government on this. So that's really the ugly part of things. I guess part of the positive, and Julie, you kind of mentioned that some of the things that you've already been doing that are in place are so necessary. Last Friday, I was on a conference call, and some of you might have been on it too. There were quite a few people on it, with some of our school superintendents. And the superintendent from where, she brought up a very good point, talking about students that are in need of services now, that they themselves may be dealing with substance abuse issues, or maybe in a home with someone that is, and just so afraid of what may be happening in those homes and not happening over these few months. And, we're so afraid of losing those kids. This backslide of recovery, I just don't really know. I mean, all of you know much better than I do what that really will translate to, but it's obviously something that we're going to see the effects for months and probably years to come. So I hate to be such a downer comment to speak with you on this, but I think, we have to be aware of what some of the constraints, and especially the budget constraints going forward, and figure out the ways that we can support one another, and to make sure that when resources, and hopefully a large amount of resources getting in to the state, but they are also dispersed the way they should be. I get really upset when things tend to stay east of 495, sometimes, and there is truth to it. We are often forgotten in areas in central and western Massachusetts. And we have to fight like crazy for that regional equity and making sure that we get what we need. I do have to tell you that you've got a great legislative delegation out in this area. I'm probably not telling you anything you don't know. I know you mentioned some folks already, but we stick together. Some of us are Democrats, some are Republicans, we have an independent, but when it comes to looking at issues that matter for central and western Massachusetts, we band together, and it doesn't matter what that initial is after our name. So, I'm happy to take any questions now. I'm not sure what the rest of the format was, but I just wanted to really say a big thank you to you, and we'll do the best we can moving forward.
Thank you, Senator Goby. Do we have questions here? I'm not sure that I see any here. I have a question. You mentioned money coming from the federal government. What can we do help make sure that money comes in.
I think one of the big things, Mary Ann, if you haven't already, to absolutely reach out to Congressman Neal as well as to Senators Warren and Markey, and make sure that they know that as they're doing funding, if they are to probably put some language in there that a certain amount needs to go to recovery services. And it would also be helpful to make sure that Central and Western Mass aren't left out. I mean, that's a big part of it. That whatever sort of metric they are using to distribute that money, that they have to realize that we need a good portion of it.
So we advocate Capitol Hill to make sure it comes down to the state.
Absolutely, absolutely.
Thank you, and thank you for your honesty about it, and also for the acknowledgement that there is going to be a great need. So we do need to have those resources available in a very, very big way. Excellent. All right. Do I see any other questions here? All right. All right. I want to thank you very, very much, Senator Goby, and I'm going to turn it back over to our wonderful Alison and Magda.
All right, so thank you so much for those remarks. Now we're going to hear a little bit about how is the pandemic and COVID-19 is affecting the communities of color in our area. And for that, we have Dr. Claudia Martorell from the infectious disease specialist, director of the Research Institute of Springfield, Mass, and Dr. Madeline Aviles Hernandez from Gandara. She's the director of Outpatient and Recovery Services. So you ladies are on.
Okay, so I am going to go over some of the data that is available on healthcare disparities related to COVID-19 and the Black and Latino communities in the US. And what I think it's important to note is that, of course, healthcare disparities in the US is not limited to COVID-19. You know, you probably remember that back in 2003, the Institute of Medicine did come out with this particular document on equal treatment, confronting racial and ethnic disparities in healthcare, and it was published, and it really states that race and ethnicity are significant predictors of the quality and healthcare received even when socioeconomic status is accounted for. So with that said, the CDC, the recent data from April and even May are showing that COVID-19, like many other infections or diseases that affect the minority population, this particular pandemic is disproportionately affecting and impacting the Black and the Latino communities. And that is a reflection of the unresolved, long-standing racial and ethnic disparities. So a little bit on data, you know, identified cases, hospitalization rates, and death rates, data may vary across states and regions. A lot of it has been affected by what is going on in different sites and testing, of course. But if you look at the Blacks, for example, they account for 13% of the US population, but they make up 30% of the COVID-19 cases. And if you look at Latinos, that they account for about 18% of this population, they account for 17% of the COVID-19 cases. And if you look at the CDC data as well, you will see that compared to the COVID net 14 states that is included in that data set, the African American population account in terms of hospitalizations for about 30 or 31% of those, and those are within most age ranges, you know, younger and older. Massachusetts data, there is some data in terms of Massachusetts, but there is really, if you look at Massachusetts data, there is a high missing and unknown percentage rate in terms of race and ethnicity. So that is one of the things that needs to improve, and I have been doing this testing myself, and when I do it, there is no place to mark the race and or ethnicity of the person when the testing is being ordered. In terms of reasons, why is this happening and why minorities are at increased risk for serious illness with COVID-19? Minorities are affected with higher healthcare comorbidities that are associated with higher hospitalizations and death rates. And those are, for example, diabetes, asthma, high blood pressure, and obesity. And there are others. And you have seen some of that in New York, for example, New York City, with the Hispanics and diabetes, but also with the African-American population as well. Minorities in general are also more likely to work in service industries, such as restaurants, retail, hospitality. Many of them have been laid off or furloughed. And they are also often working in jobs that are not amenable for teleworking or telehealth from home. And, those work settings may increase the risk for, increased risk for COVID-19, but also income loss besides the health threat. Transportation has been always a risk factor for health disparities in general. So just keep in mind that minorities tend to have, they may rely higher on public transportation, so that, congregate settings or places where there is high amounts of people is a higher risk for higher amounts of infection. And, these patients may also not necessarily want to go to work because they want to protect themselves and their families, but they may need to work because they may be the only source of income for their family or the major source of income for their family. So in general, members of the minority population are also from a low socioeconomic status, and that has been associated with a lower health outcome. And they may be also living in unstable or substandard housing conditions, multi-generational families or low income or public housing, perhaps incarcerated and homeless shelters. And again, those are congregated settings. And as I said earlier, those are settings where there has been higher rates of transmission among household contacts. And this housing situation it may be difficult to follow the social distancing guidelines, the hand washing, the self-quarantine, isolation guidelines that are right now in place. There may be issues with access to healthcare insurance. There may be some people with no health insurance, like illegal or legal citizens or underinsured. And in my practice, I have had some people that right now have no insurance because of the COVID-19 emergency, and they have lost their jobs and insurances. So that has led already to some treatments being interrupted in terms of HIV treatments and hepatitis C treatments. Other issues, lower access to healthcare services, mental health, substance use. Telemedicine is helping with those, I have to say, but again, disruption in the healthcare system has been an issue. And people are anxious about the COVID symptoms. So anxiety level is going up, and they may think that the anxiety symptoms are COVID, so that generates increased burden in the healthcare system as well. Cultural sensitivity, language barriers, especially in the monolingual Spanish speaker patient. So, the importance of awareness in the healthcare provider and healthcare system. And one of the big things, in my opinion, and it has been documented, but I also see it a lot, is the misinformation. Not only education and health literacy, but misinformation. These are the constant things that I'm hearing right now, like COVID is just a cold, I am not at risk because that is an old people's disease. My patients with HIV, they think they are not at risk because there are some of the HIV medicines on clinical trials right now. I'm healthy. This is a virus made up by the government to kill us. Those kinds of comments are coming up quite frequently. I can only get it if someone has symptoms in my household. The stigma, right? Some people knowing they have the infection but not wanting to disclose it, or going to work and being afraid of getting rejected because they have this particular infection. So those are the main barriers or reasons for healthcare disparities. In terms of policy recommendations, I think it would be wise to get better data in Massachusetts not only on racial and ethnic data, but also on socioeconomic status. Because as you can see, some places, it's not only race, but also the socioeconomic may have an impact in disparities. I would say that expanding telemedicine, it has been an advantage to do that, but not only, some patients have no access to video or they don't have smartphones. So allowing the phone visits has been or would be helpful. Releasing some of the insurance restrictions, like maybe not needing primary care referrals would be good. And I would say that allowing those restriction releases at least until there is a vaccine available would be useful, or even more so if available. Language and information, the information needs to be simple for these particular populations, especially messaging and the access to testing in sites that are being used by these particular populations. You know, these public health concepts are not easy to grasp. People really don't know what social distance means. They are being careful outside, but then they go to their homes, or they are working, they may get exposed, but then they go to the house and they are not keeping the 6 feet distance inside their homes, and there is like 10 people living in the same household, and there is a lot of secondary transmission going on within the households, and there is data showing that as well, and you have seen the numbers in Massachusetts. Many of those are in congregated settings, and you know that not everyone is getting tested. You know, bilingual providers, peer navigators, case managers, community health workers, all of those help now in a telemedicine setting might be helpful as well. So, and there are some other recommendations as well. But in general, I think that the COVID-19 pandemic or the disparities should be situated in the context of, you know, resource deprivation, because there is not much caused by the lower socioeconomic status and the stress, the chronic stress that is brought by the chronic racial issues, including discrimination and the place-based risk. Thank you.
Thank you very, very much. That was really important information. There's a question here from Della Blake, and the question has to deal with, for those that may be disenfranchised, and the governor opening up, how are people going to get the testing that they need?
Well, that has been one of the, if I understood correctly, the question was, how should they get tested, or where? Was that
yes,
the question?
when and where, and is it possible?
Yes, there is. So one of the main barriers has been access to testing, right? That has improved. It is not perfect yet. It is not perfect yet, but access to testing has improved. And there are, at least in Western Massachusetts, and I know that in the east part of the state also, there are testing sites. And even in my office, I am able to do testing right now, both PCR testing for people with active infection, right, which is an nasopharyngeal swab. And then also there is some availability in some places for the antibody testing, which would be the test that helps more for surveillance or for people who have been exposed or who had the infection weeks ago or months ago, or who may also be potential candidates for convalescent blood donation.
Thank you. We have, I'm muting Alison. We have Alison and we have Magda, who will be moderating a few. I can do it, but I want the real people to be able to shout out to our next person.
Okay. So now we're going to hear from Dr. Marilena Velez Hernandez from Gándara. She's the Director of Outpatient and Recovery Services.
And thank you. I just wanted to mention too, I just wanted to make sure that everyone's aware that of the chat box. So if you do have any questions, feel free to put that in so that when we have a discussion time later on, we'll be able to answer the questions then, just so that we're on track with time.
Excellent.
Hi, everybody. Thank you for having me. My name is Dr. Madeline Aviles Hernandez. I am the Outpatient and Recovery Services Division Director for Gandara Center. And so some of the key points that I'm going to bring up, it's following up on some of the points that Dr. Martorell mentioned already. And if there's something that we have, I want to start by saying that if there's something that we have seen out of this, the COVID-19 pandemic and the resulting economic downturn, is the fact that it has had a very negative impact and even created new barriers for the individuals and the communities that we serve, especially those already suffering with mental health and or substance use issues or disorders. We know that even though it was necessary, especially to prevent the loss of life and to promote safety, for public measures to be taken, like social distancing, quarantine, things like that, those same measures became stressors really for individuals with pre-existing mental health or substance use disorders. Again, those same things led to reduced access of resources, increased stress due to job loss or strained finances. And something very important, especially for individuals in recovery, was being somewhat disconnected from those social support systems. And this is a key thing, especially for the individuals that we serve, because we know that individuals who struggle with issues of substance use and or mental health, that's a big piece for them, as it promotes increased well-being and stability. So the fact that those same measures that needed to be taken for safety and to prevent loss, so those same measures have led to, have had these unintended consequences. So we have definitely seen in the population that we serve, those increased symptoms, those increased difficulties and needs. Again, some of those things that have been very present, the fear, the anxiety, the uncertainty that surrounds the pandemic, people experiencing changes in sleeping or eating patterns, difficulty concentrating, those same conditions that Dr. Martorell was mentioning that are very prevalent in our population, in the minority population, which is diabetes and high blood pressure, asthma, all of those things. We have seen those problems worsening. We have also seen increased use of alcohol and tobacco. So again, the same issues that were probably already there and symptoms and needs that our population, our individuals were already experiencing, we've seen those intensified and increase. So what have we done in able to address this? You guys heard from Deborah Flynn Gonzalez and Julie Gagney, and I'm very proud of the two of them. They run 2 of the 5 recovery support centers that Gandara has across the state. So, and they touched a little bit on some of the things that they've been doing. So as an agency, we've done multiple things to continue to support our community. We've all 5 of our peer recovery support centers started doing virtual programming. So every single thing that they were doing before, they still do, but by way of social media and then virtual platforms like Facebook Live. And that's been very important because, like I mentioned initially, the individuals that were already feeling stressed and somewhat isolated and disconnected, they have been able to engage again, and they have been able to feel supported through those through that programming and those groups that have been running consistently since we transitioned to telehealth and virtual programming back in March. Our clinics have remained open. So our main clinic, hours of operations never changed. And we made it so that what we wanted was to stay open and continue to support the individual. Granted, the way that we were delivering services needed to change. And we took those measures and we changed the way we were doing things. But ultimately, we still wanted a place where individuals could go to if they needed that level of extra support. So we've kept our clinic open. Services, although limited, continue to be provided on site, but the vast majority of our services have been done through telehealth, like running groups and individual therapy sessions. All of that continues to be done, and it has been pretty much uninterrupted. And another thing that we have been able to see that has been of great importance and has had tremendous impact in the community are the level of support that we've been able to provide virtually, by phone, video conferencing. So we've pretty much utilized every single platform there is to be able to connect with with our individuals, to be able to continue to provide services, recovery coaching services, case management services, therapy services. So those things have been very much part of our day-to-day. And we have given our staff the tools and the supports to be able to do those things and work within their specialties and competencies to support our community. Something that we are now focused on is this new transition. What's going to be our new normal? And again, with change comes anxiety, uncertainty, and I'm pretty sure that all of us that are here today have experienced a lot of that. The not knowing where we're going, the not knowing when this whole thing is gonna end. What is that new normal gonna look like? So acknowledging those things, it's very important when supporting individuals with individuals that are already in a vulnerable situation, like the communities and the people that we serve. Focusing on making sure that our services are culturally competent, that our clinicians are providing linguistic proficient services, that we are really accessing their needs and addressing their needs. That is going to continue to be a focus for us, and it's going to be something that we're going to of course continue to provide, but actually move into enhancing those things. And something that I also want to point out that I don't want to ignore is, not only do we want to make sure that we continue to support our communities and our individuals, especially those with greater needs, like the ones that we serve, we need to be able to also support and not lose sight of those individuals that have been in the front lines. Most of us that are here today are in the group of essential employees. A lot of us have been in the front lines. A lot of people have been out there providing direct care to the individuals that have been most vulnerable. So also paying close attention to those employees, those staff, making sure that their needs are addressed. It's something that we're going to particularly pay close attention to, and that we want to make sure that we create a plan to address and support them as well. I don't know if anybody has any questions or if there's anything else that you guys would like me to address.
There is one question on the chat, and the question says, Dr. Aviles, do you think that COVID-related increases in alcohol and other substance use disorders will put a strain on the addiction treatment continuum once the states reopen?
So, oh yes, I'm still on, I'm sorry. Do I think that there's been an increase in substance use? And do I think if that's going to put a strain on service provision? Is that the question?
Yes.
Okay. I think so, yes. Some of the things that we are seeing is because we had to create this new normal, and this new normal for a lot of the individuals that we serve really played a big role against them. The social isolation, the distancing, the not being able to access resources the way they normally would, being able to be out and about and having contact with people. That has definitely been our new normal. And those are factors that we know are part of in the symptoms that are experienced by people with depression, people with anxiety, people with substance use issues. So by way of those measures being in place, it was those same factors that have contributed to an increase in, yes, alcohol and use of tobacco and other drugs, and also worsening of mental health symptoms. As far as service delivery, I think that we're gonna see an increase absolutely in the traffic, and we're already seeing some of that. We've already started seeing an increase in referrals. We've already started seeing an increase in individuals trying to reach out and connect with us to be able to obtain supports and get services, because they've acknowledged that some of these symptoms and some of these measures, although positive on the one side, have had a negative impact on the other. So they want to make sure that they address those things. And a lot of them have reached out to make sure that they put the supports in place so that things don't get worse for them. So I think that we're going to continue to see a lot more of this. I don't believe that when we fully transition, this is going to be the end of this. It's actually going to be, this is something that is going to be very present, and it's going to become part of our normal for many more months to come.
Thank you for your answer on the chat. There's also a lot of you that have added some more information on how to get services in regards of testing and so on, and it's added to the chat. So later on, we'll accumulate all this information and send it out via email. So thank you so much for your time, Dr. Aviles Hernandez. I'll see you soon. Let's take a little break now. Is that what we're doing?
Yeah, we could do that. You could take a 3-minute break, and we could also have a discussion at the same time for those that would like a discussion, if that's what people would like to do.
Sure.
Sure. And if you do have questions then for the discussion, if you just wanted to put it into the chat box, and then we can moderate it from there. But feel free to stretch your legs, get some water. Thank you all for being here today. We've had a great discussion so far.
Absolutely. Absolutely. Wow. Is Dee Calvert or Ruth Jacobson Hardy here?
Hi, Marianne, I'm here.
Okay.
I think Dee had to hop off.
Well, due to the nature of her position, there's a question in the chat box. It says, and this is from BSAS, in a residential program, discharge a resident for administrative reasons during COVID. This person was put at a certain inn and then offered a shelter. A hearing was held by the program that discharged her, and being allowed back was not an option before the hearing results were determined.
Okay. That sounds like a very unfortunate and tricky situation. So what I can say is, in general, programs still have the ability to, discharge people administratively in the COVID times. And I think there is a balancing act. There's a very tricky balancing between protecting the safety of people within the residential program and the individual needs. So I can't comment on what happened in this particular situation. It's obvious that each situation is different. And I'm glad to hear that there was at least a hearing. I think that if people have concern about any of our programs, you can also, you do know that we do have a complaint line that people can call. And we take complaints very seriously. And I will give you that phone number so that you all have it, and I can type it into the chat as well. So it's 617-624-5171. And, I think that in the COVID times, things are extremely complex and challenging. And people are really balancing so many different pushes and pulls and needs. And it's also a very highly stressful time, so that people are often really pushing their capacity to, think clearly and act rationally. So it's not a great specific answer, but the reality is that programs do have the capacity to protect the well-being of others in the program.
Thank you, Ruth. Another question that just popped up from Kilm Gohuli. So are there policies that we can collectively advocate for? One example, it seems, is advocating for continuing telehealth, and the way that we're doing it now would be very valuable, especially in the way of MOUDs.
Yeah, I think that's a great point. The way to advocate for it is, I think, through your legislature, and we're also seeing that there are many, many positive things that have happened, and we don't want things to go backwards. We want to keep things moving forwards, and telehealth is definitely really taking a great leap forward. And I think this whole situation has given us confidence in experience and seeing that telehealth is very successful. So definitely go to your advocacy groups, ABH and MOAR, and your legislators. And, I definitely think there are ways that we can make some of these changes stick.
I don't want to, this is Kim Gilhooly. Sorry, I'm not on video. There you go. There you go. I don't want to waylay the agenda, but I just want to say this is like 140 or so people. It's like a powerful group of people. And so that is one example, and I'm happy to definitely speak up individually. But I guess my point is, like, we're on this forum, which is about addiction policy and COVID-19. And if there was a way to harness the power of all of these people, that would be great. So we can talk about it after, but that was my point.
This is Mary Ann Frangoulis. Thank you, Kim. That is on the agenda for what we want to request. So it's one of the top issues. So definitely gathering people together. I'm glad that you mentioned it. And it's something that you want to advocate for, because I know there will be many others. I was just wondering,
Connie from ABH, can you hear me?
Oh, Connie Peters, go ahead.
I just want to say this is a huge issue for ABH, and we've also taken it to the federal level through the National Council for Behavioral Health Care. and that we are pulling together information from our provider system to try and make recommendations. We're hearing from the federal level that once this emergency ends, but who knows when that will be, that it officially ends, that things will probably go back to normal, but we're going to be pushing for the certainly more telehealth. There are definitely a lot of, from what I hear, a lot of individuals getting treatment who prefer to do the telehealth counseling, et cetera. So I just wanted to put that out there that we are working on this as well.
Right. And Tom Codier is on the, is Tom Codier still here? Probably not. Why I mentioned Tom Codier, people should know he is, he was on earlier. He's the SAMHSA New England Regional Manager, and Calvert had mentioned him before in regards to the telehealth too. So are we ready to get back?
Thank you very much. I just wanted to check in, is Helen Collin Harris still on the call?
Unfortunately, the commissioner is unable to join us today. She was called in for an emergency meeting with the mayor in response to COVID-19, but she is willing to take on any question. We can bring questions back to her if anybody's interested in asking us questions, and we can do our best to answer them here, but unfortunately she can't join us today.
That's okay. Thank you, Chelsea. Yes, if you have any questions, again, for the commissioner, please feel free to put that into the chat box. And then up next, we have Rose Evans. She's the Vice President of Operations for Behavioral Health Network.
She has someone with her too. She's with Dr. Ruth Pote.
Yeah, this is Dr. Pote. I'm actually going to start, and Rose is going to follow. Behavioral Health Network runs 2 detoxes, 2 CSSs, and 3 very large long-term recovery facilities, congregate housing throughout Western Mass. We also run 2 methadone clinics. We're the bridge clinic for the Hampton County House of Corrections for buprenorphine and also for Bay State Medical Center. And we run a full-service addiction clinic for buprenorphine, injectable naltrexone and injectable Suboxone. And despite the COVID dumpster fire, we've managed to keep it all in the air without much disruption in service. And as everybody knows, we all do really hard work every day. Managing, helping people who struggle with substance use is at a baseline hard work, and COVID just makes the whole thing harder. Every day I wake up and I say that line, COVID made a hard job even harder. And guess what? This is just our first spike, right? This is where we are right now, slightly on a downswing, but we could be spiked again in another 3 or 4 weeks. The entire state could be locked in again. And what I keep having to prepare for is the long slog that is ahead of us. Deirdre Calvert had her Boston Marathon sweatshirt on. I hadn't realized she was a marathon runner. She looks like a marathon runner, but all of us have to become marathon runners because the next 15 months are just going to be hard. And I think everybody on this call is really tired. We're tired of it. We're tired of the disruption it has in the lives of our patients, because our patients at a baseline are ambivalent, right? There's ambivalence about changing your life and getting better and giving up this thing that has been your go-to for your mental health, for numbing up psychological pain or childhood trauma. It is so hard to do that at the best of times. That to say, oh no, I'm going to pack my bag and move into a 3-person room in a 32-bed congregate living facility to spend the next 7 to 12 days in that setting makes no sense, to be honest with you, right? It's irrational to go join congregate living, yet that's what detox offers. So people need it, without a doubt. I'm the medical director of these places. I believe in acute treatment for people who are so sick that we need to remove them from their setting to get better. But the work is hard, and the AMA rate has never been higher because people's ambivalence is so high. So you guys all know this because you take care of them at the entry level, and at the exit level, there's more chaos than there used to be. And it means that sometimes beds go unfilled, yet we all know that people are drinking and drugging harder than ever before. I want to talk a little bit about alcohol use disorder. Healthy people who maybe weren't drinking too much 2.5 months ago are drinking too much now. And we all know that at a baseline, 10% of Americans have an alcohol use problem. My guess is it may be 12% now, maybe even higher. The liquor stores are thriving. There is the one business that's making money hand over fist right now. So we've been doing training on outpatient management of alcohol use disorder. 80% of people with alcohol use disorder don't need to go to a detox. They're going to have some withdrawal, but they can be managed in an outpatient setting. The problem is that most primary care doctors do not know how to do that work. And it's actually critically important work, how to help people in the outpatient setting. So if we could build that capacity for primary care providers, for homeless shelters, for other settings where people with alcohol use might show up. And I just want to say that I so agree with everything that everyone has said, because everybody on this call is doing the hardest work imaginable right now. And our burnout as providers is going to be high. We've got to make sure that we stay with it, because we are on mile 4 right now of a 26.2 mile run. So I'm going to let Rose jump in and fill in anything that I left out.
Rose Heavens here, are you on mute? You can unmute yourself.
Okay, can you hear me now?
We can, that's wonderful.
Oh, great. Okay, good afternoon. This has been an inspiring call, and I just want to thank everyone for all of the incredible work. Certainly, we've been in it. What are we into? About week 7 here, somewhere around there. And it's taken a lot of work, a lot of effort, tenaciousness, and being careful and patient through this process of trying to figure out the landscape that we're in right now. So it's been inspiring to be on the Zoom, be on the call, to listen to all of the great work that's happening. And I want to thank Dr. Poti for the update, and certainly Mary Ann for hosting the call. Really appreciate you pulling everyone together. Yeah, so here we are. It's been a journey, and I think that we talk about where we're going and what the landscape is going to look like, and I think it's really hard to know at this point. We certainly are learning a lot of lessons, and I think some of those lessons we'll be able to incorporate into the new normal as we kind of lean in towards that and set the stage for some creative, innovative work. So we've talked about telehealth, we've talked about different ways of engaging. I know our recovery coaches at BHN have really been very successful at reaching out to folks telephonically, and that has been extremely helpful and supportive. We figured out how to provide transportation to people to get them to our different facilities for treatment. We, unfortunately, at the very beginning of this pandemic, we wound up having to close down within 3 days one of our 32-bed treatment programs that we had just completed setting up. So that was really challenging for staff and heartbreaking, but we were able to convert that setting to a place for people to sleep and eat and do laundry. Our staff are, some of our staff are quarantining right on our campus in Greenfield so that they can continue to work, but that their families and loved ones stay safe as they do this challenging work. So that's been an innovative and creative strategy that we've implemented on our campus in Greenfield. We've provided scrubs for people so that they can work and work in scrubs, and then they can change and shower before going home. Again, I mentioned that we're providing meals to people that stay on the campus and stay overnight. We have leadership calls. We were doing them 7 days a week and then reduced them to 5 days a week, and now we're down to 3, where we all connect. It's a group of about 13 of us, so the leadership team, and where we talk about what's going on. Do we have any patients that are COVID positive, symptomatic, or our staff? And, do we have any staff that are symptomatic or COVID positive? And how are we reaching out to our staff that are COVID positive to make sure they know that we're paying attention to them and thinking about them and want them to be healthy, and do they need anything? So a lot of outreach there, talking about self-care. How are we taking care of ourselves and helping our staff with measures towards self-care. So we've really had to think outside the box. We have a website on a link on our website to all sorts of different COVID positive support networks, both for our patients, our residents, as well as our staff. So we've been keeping that up to date. And then we're also trying to figure out how to pool our staff as our staff gets sick and need to take time off. We're thinking about creative staffing strategies to address that issue, staff being cross-trained across all of our service lines so that we have flexibility and we're nimble to meet the needs. And you know, and it's a changing landscape every day, even within hours, guidance changes from CDC or from DPH, and we're staying on top of that. BHN has a guidance work team where we collate and collect all of the guidance that we receive on a regular basis and crosswalk it, and then we push the updates out to our staff, and so we talk about that on our leadership calls. So we've really been working on being as creative and responsive as possible. And then we also have been doing some work with the Commonwealth Care Alliance, with the motel in Northampton. That's the isolation and recovery motel, where we've reached out. We've been doing some trainings and coordinating and facilitating of some meetings there. And then also offered Narcan and then MAT services when necessary, as well as making sure that as folks are recovering, that they are aware that we are available to provide treatment services, if it's ATS, CSS, or at the recovery home level. So we're in touch with folks there. And then, of course, Ruth Jacobson Hardy's been having calls, so that's been helpful to bring the region together. And so that's kind of it right now in terms of BHN and the BHN update. I don't know, Marianne, is there anything else in particular you'd like for me to touch on? I know I want to be mindful of time.
I think that you've really, between yourself and Dr. Poti, covered the gamut, and my heart goes out to those that have gotten the COVID while trying to help, and as you talked about creative staffing. So
yeah, and you know, I think the other piece that has been very powerful is that both Dr. Poti and I have locked arms as leadership within BHN of the addiction and recovery services, and we're working 7 days a week. We're showing up at all of the sites.
Wow.
And modeling what it means to work in the face of this intense pandemic. And we're working 15, 16-hour days, both Dr. Poti and I, and making sure that we're there, that we're present, that we're visible. Just like we're asking all of our staff to do that, we're asking that of ourselves as well. And the leadership within our division, they're all working on site. And unless there is a significant health conflict, then we don't want them to be at risk. But every day, our leadership is showing up and making sure that we're responsive both to our patients, our residents, our staff, the community, and the various regulatory bodies that we partner with, and our different stakeholders and community partners. So I feel really proud of that. And I think that we're all in this together, and I think we have a lot of lessons to learn, and I look forward to when we don't have to worry about this every single day. But meanwhile, here we are. Wow. Thanks, Marianne.
Well, thank you for being visible and vocal and valuable and helping all of us become victorious. Yes.
Hi, Marianne. Could I just pipe in here for a quick second?
Sure.
I do just want to say that our providers have done an amazing job of continuing services and in keeping access open for people who need SUD treatment. And it's not easy. And I think that, you know, the things that Rose and Dr. Ruth have talked about really highlight how important it is to be so dedicated and willing to do what's necessary to keep people safe, to provide services. If somebody becomes symptomatic, they don't get kicked out of treatment. They are able to be accommodated in a protected and safe way. Many of our programs have set aside rooms for anyone who might become symptomatic within treatment so that they can stay in the service. They don't have to be moved to a shelter or a hotel. They can stay right there in treatment. So I just wanted to get that out there. Our providers have done an amazing job at figuring out how to keep things safe, the protocols, the protective equipment, and the support to the staff, the daily cleaning and all that's involved with making it safe to be in a bedded treatment program in congregate care. So, you know, I think whatever we can do to get the word out that it is safe to be in a ATS program, in a CSS, a TSS, or a residential program, that it will be useful for people who need treatment. Thanks.
Great. Thank you very much, Ruth. And I just wanted to be mindful of time too. So I believe the next up we have Dallas Clark. He's on the call.
All right, thank you. My name is Dallas Clark. I'm long-term recovery. And what that means to me is I haven't used drugs or alcohol or was any criminal behavior since October 17th of 2017. And I always add that in there because part of my recovery is gun violence. And the community I come from, I have people that's dying from gun violence. And in my community, that is looked at as a public health issue. I asked a couple of questions. I work as a recovery coach. I had an opportunity and was blessed to become a recovery coach. In the beginning of my recovery, I had a recovery coach and a sponsor and a therapist, and I use them as needed to help me in my recovery. One of the questions I was asked is as the challenges, the barriers during the COVID, how it affected me working as a recovery coach. And a lot of people answered it already. The challenges more is is helping people just getting to bed or getting them safe places, and the lack of resources and the resources that became available. Like I use the Spring for Recovery, I use ASS, and today, like the challenges with the COVID is helping people, keeping them in their recovery. I had an opportunity over the weekend to pick somebody up and to bring them to detox, which was a good thing. Then I had an individual which had to leave detox because the detox was open. So it goes both ways. Whereas what the sheriff was talking about, it's hard to get people into a residential coming from the community. I think that's been the biggest challenge to me. And talking over the phone, like I had an opportunity convincing somebody, not convincing them, but they was looking to get into detox. I was 15 minutes away from them. By the time I went to go pick them up, you know, that small window closed. So I think it's a big challenge as me working as a recovery coach for that. And at the same time, like working in this field, like the substance abuse, like this academic, whereas somebody mentioned, a couple of people mentioned it, like where we putting our health at risk. That's a big thing too. Like we putting our health at risk with those that work in the programs, those that work outside of programs that is out on the front line from harm reduction. And also, like what I work for MHA, and what we started doing is having a rotation of 2 weeks of the staff members where they don't have to keep coming in and out, whereas they sacrificing to leave their family to stay in the program for 2 weeks. to make it more safe. So I want to put that out there also. And just today with the COVID and those that with the substance abuse, I'm getting more calls. I'm having to not able to go to certain houses now, which that was a big support, because that's what we are as recovery coaches. We are that supporter for them, and a lot of them is got the extra what you call it, the emotion, depression, anxieties kicking back in because they can't leave the house, they can't see their family, they can't get visits. So the calls is becoming more. Like the individual I dropped off, he called me like 10 o'clock at night. I got out of bed and took him to detox. I'm in this career to save people's lives. And thank you for listening.
Thank you so much, Dallas. You always warm my heart because we who have seen you at our More Springfield meeting have seen you from the beginning of that chapter of your life. So to see you so committed helping others, it also, you demonstrate the value of why we all want recovery coaching go on and be a service, and also protect recovery coaches in a big way. I'm flattered to be able to announce our next speaker. We have Representative Marjorie Doctor, who is chair of the Mental Health Substance Abuse Recovery Committee on the House side of our state legislature. Not only is she doing that, but she is also chairing the Behavioral Health COVID-19 Committee, taking in all the facets of behavioral health. And this is the third meeting that she has responded to, that I've asked her to come to, that we have asked her to come to. So before I go any further, I'd like for Chair Decker to speak. Again, we're just really grateful that she's here for our Western Mass Policy Forum with HCAT. Thank you. Representative Decker, are you there? I just got a message that she was jumping on.
Unless she's on a phone call, Marianne, I don't see her name in the.
Okay.
Yeah, I don't see her.
All right. Akriti just said she was coming on. Okay. Well, I just lied for a moment. Maybe we could start with one of the coalitions. Is that who's next? And until she comes back on, and I do know she has to come on. Oh, wait a minute. No, this is a 413 number. Nope. Okay. All right. So who would like to go first? How about Deborah McLaughlin from Franklin County Opioid Task Force?
Hey everyone, thanks so much for organizing this call, Marianne and others. I'm actually putting information about us in the chat box to share. I know in the interest of time, there may be just other questions that folks have just based on the really excellent comments that so many people have shared. So I don't know if you just want the last 10 minutes just to be a Q&A, maybe. I'm just asking that as a process question, but thank you so much. It's been great to be on it, and we'll just share our information in the chat box.
That would be great. Thank you very much, Deb. Yes, if anyone has any questions, you can certainly just put that into the chat box, and we'll use the last 5 or 10 minutes that we have.
Okay. I would just like to acknowledge that all the way from Boston, Massachusetts, we have Lorraine and Loretta here from Step Rock. That's a wonderful thing. Very good.
Marianne?
Yes.
It's Kirsten. Hi, I did see a question a little earlier for Rose and Dr. Poti from Abigail. I can read it, or Abigail can get on the phone.
Is Abigail? Yeah. I can unmute her.
I was actually
I response from Dr. Doherty. Thank you. We had a discussion about how the increase in alcohol, a significant increase in alcohol, and potentially the use of drugs at home too, while people are not at work, may come as a surprise to some people when they are released from social distancing and find themselves in the workplace, and may not realize that they now have a substance use problem, or that their previous issues may have increased, and it may also be a problem. I've been looking for statistics on this, or some credible interviews advising people about this issue, and we haven't found it. So if anyone has seen anything, I would love to see some of that research. Thank you.
Responded to Abigail in the chat box on this one. I think, as everybody knows, data collection in any medical illness is always slow, because it takes years to collect data and see some trends, that we're often looking at trends that are a couple years old. So where statement about alcohol use seems to be increasing is based on alcohol sales. So that data is easy to find. That if you talk to people who run liquor stores, or if you look at the sales rates at any place, they are high. People who run liquor stores describe this pandemic as a Super Bowl weekend every single day. So actually, people should reflect upon their own lives. I mean, there's a lot of us at home, a lot of us are stressed out, and that sort of go-to of popping a cork or flipping the tab on a beer can has become very normalized for people. I think Abigail's question is a really critical one. A public health response to something that we think is a spike would be to let people talk about it openly and say, oh, you know what, you may be drinking more than you meant to. Why are you drinking? That's always the question I ask people, is tell me why you're picking up that glass of wine now. If it's because you're anxious, it's because you're stressed, it's because you live differently, that's not the right answer. You need to do one of 100 other things that will make you feel better. You need to go for a walk, you need to pet your dog, you need to do some yoga, you need to meditate, you need many other healthy ways of managing your stress and anxiety. And this would be messaging that comes out from anybody on this call, or any behavioral health entity, or an article that gets written, because people should self-reflect upon how much they're drinking right now. It is, as we all know, the legal tobacco, highly addictive substance in our community. And Abigail's question had to do with, how can we help employers when people return to work? The thing about alcohol is people can be pretty functional alcoholics for a long time before things really fall apart. And it doesn't mean it's good for their health. You know, we originally thought there was a strong association with smoking and COVID bad outcomes. It doesn't seem really to be there, at least on the data right now. Diabetes, hypertension, obesity are the big ones. But alcohol or liver disease, any organ damage like that, also is a big one.
Thank you so much. Representative Decker is now here. Representative Decker, I'd like to say a few words.
Thank you, Marianne, and I want to thank everyone who is on this call and everyone who is supporting the work that you do. I am the chair of the Committee on Mental Health, Substance Use, and Recovery, and I'm happy to be here with you for a few minutes before I jump onto our caucus call for the House. For those of you in Western Mass, I just want to let you know that although I live in Cambridge and I grew up in Cambridge, Western Mass is very close to my heart. I went to UMass Amherst. I was elected to Amherst Town Hall when I was there as a student, and I worked for the great Ellen Story, who was a state representative. And so I really do make sure that when I'm doing this work, that the lenses of Western Mass and understanding Western Mass is not just Springfield and Amherst as well, that I really am carrying the communities that are that you all serve. And I'll tell you a few ways that I've been doing that as a chair and through the lenses of the pandemic that we're in. As a chair, I made sure that I held several meetings, hearings in Western Mass. And I also went to go visit a number of places in Western Mass that are doing recovery work, or also related for justice-involved individuals. We also, I'm now, in addition to chairing this committee, I am chairing a House task force or conversation. I had to make sure that was a laugh and not a cry, sorry. I'm not sure. Oh. Okay, the person who I thought laughing might be causing the other person to cry. Sorry. This homeschool thing's going really well.
Oh, God.
And, to tell you that I'm leading a conversation on the issues of sexual assault and domestic violence. And what I have done is proactively made sure that we have a number of different voices and providers from all of Western Mass who are on these calls. So as the chair of this committee through the lenses of the pandemic, I started out in the second week of the pandemic, twice a week holding a task force call on Zoom that are visited between 50 and 60 advocates, providers, clinicians, hospitals, to talk about how are we doing meeting the needs, behavioral health needs of our community members. We now meet once a week, and through that work, we put together a list of issues that we really want the administration to press on. So I'm constantly in contact with DMH, Mass Health. My mind, sorry, this like working from home with kids is going well too. That we really are in constant contact with them. And then what we've been doing with the folks who visit us on the call once a week is I have a slide deck of all of the questions and all of the needs that folks have asked me to press in on. And we then go over the slide deck with the answers from the administration to really make sure that we are keeping track of all of the needs. In between these meetings, we've also made ourselves available, both myself and my staff, that if you are working with an organization and you're finding that there's obstacles to access, whether it's MAT access, or whether it's a peer group, or there's an issue with PPE in a congregate care, we're focused on the issue of rent in sober homes. There's a number of issues that we've been keeping our eyes and ears on, and when we see the possibility of trying to weigh in on this and connect the dots for either individual organizations or regions, we do that. So it's not just waiting for these weekly meetings. But to tell you, we've been connecting the dots on the issues of what do people need to be safe, people who are in recovery, what do people need to be safe in terms of access to mental health support and services, how do we ensure that the other issues that allow people to stay safe, that they have food, that they have, looking at the issues of transportation. I know the issue of transportation is a very particular one to our rural communities in Western Mass, as well as other parts of the state. When people actually call for help, what does help look like on the other side? And are we able to provide people the kind of help that they need? So I can tell you this is like chairing this committee is really, it's a large umbrella of issues. It's also what my life's work as an elected official for 20 years has been, both as 14 years as a city councilor in Cambridge and 8 years as a state representative. And one of the things that I have really been pressing is that if we do not meet people's needs, many of you have been doing this incredible advocacy work, right? Either because of your personal experiences or your commitment to creating a healthier, just world. If we do not provide people with the tools that they need to, whether that is to stay in recovery, whether that is to access recovery, whether it means to stay home and still be able to feed your families, whether it means the fear to be able to report the support that you need and not worry about a family member being taken from you. What some might see as social issues that they thought that they could kind of turn their head, what we're recognizing is that a human rights response to the needs of many really becomes a public health response to all of our survivals. And it's very clear that we are in this together, and if we're not, then this is going to continue to just take longer and longer. And I've always said that for Marianne, one of the things that I've always been inspired by is that for those who are in the recovery community, I think you modeled for a lot of us long before this pandemic of what it means to actually lean in and take care of one another, right? That this idea that we all have a role to play to support one another. And it doesn't mean that we're not going to fall down sometimes, right? Falling down is what we all do in life. If we don't fall down, we can't stand strong. And so I just want to thank all of you for the work that you're doing. And I'm sorry that I'm so rushed through this. When Marianne asked me this, we were not in a Democratic caucus at 3. But I'm happy if there's a possibility of taking 1 or 2 questions now. And then what I would say to you is that some of you on this Zoom call may know me. If you don't, you should feel free to reach out to my office if your organization is working on areas that you think the state needs to be more supportive of. I would also encourage you to reach out to your state rep, reach out to your state senator, but I'm a House member, so I work really closely with members who represent you out there. You know, I start naming all of them and I'll get in trouble, but I know Natalie Blay and Mindy Dom, Aaron Vega, some really, really strong advocates out your way who, Paul Mark, who do a tremendous job. Susanna Whips, I can just keep going. You've got a really strong delegation of legislators out there who are in touch with me and have been in touch with my office to advocate for needs in your community. So feel free to continue reaching out to your state rep, but also feel free to continue reaching out to me. When you do reach out to me, I usually do turn around and connect with your state rep as well, just so that they know that we're all on the same page. Wow. That's what I got for the last 30 seconds, Marianne.
Wow, thank you so much. You covered everything. Very, very much. And so I know how busy you are today because you had your, the House was in session and now you've got a caucus. Us chairing that committee and another committee.
Well, more importantly, we have a $1 billion supplemental budget that the governor just filed.
Oh, tell us about it.
I'd like to. I'm just starting to read it as like minutes before this call. So that is what the caucus call will be about. And you know, I'm going to be really pressing to make sure that those who are the most vulnerable in our communities, and particularly the most economically vulnerable, for me, it's really important that whatever we're doing in the supplemental budget is actually speaking to the needs. And then for those of you who don't know me, I grew up in public housing. I'm the first to graduate from high school and go to UMass. So my lenses always have come from the place of, if we do not ensure that the most economically vulnerable amongst us actually has strong ground to stand on, if for anything, it'll just continue to cost us more. But more than that, for me, it's a human rights approach of equity.
Excellent.
Oh, I see that you've got, oh, you know what? I'm sorry. I see that you've got Rep. Carey, who's actually on my committee on this. I can't tell you, for those of you who've helped support him, thank you so much for sending him. His experience on the committee has been invaluable. And I think that I forgot to mention Rep. Sabados is out there too. So it's great to see her as well. And now I knew once I started naming reps out there, I'd be in trouble, but you have a great delegation out there. And I'm really honored to work with them. And Western Mass has a special place in my heart as well. So thank you.
Wow. Thank you so much. We really, 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 that's great. And to end it with that there might be this $1 billion supplemental. So we have a meeting tomorrow and we can put our heads together, and somebody said this is an advocacy call. So we're gonna get our pointers and our talking points in place.
I would encourage you, Marianne, thinking about what is it that you know that the state needs to do to support the community that's represented here through MOAR? What is it that you need to make sure that, in fact, this money is representing and touching those lives and strengthening those lives? And those are the questions that we have to ask as legislators and be able to answer you when we look at this supplemental budget. Perfect. So thank you.
Perfect. That's a great segue. Thanks so much.
Okay. Bye, everybody. Be as well as you can be, and thank you.
Yes. Perfect. Perfect. We are where we're supposed to be for ending the call. Do people want to stay on? This is up to Magda and Alison because it's their committee, their meeting time. Do you want to stay on for another 10 minutes or?
Feel free. I understand. I just want to be mindful of time. If you'd like to, though, Magda and I will actually put our email addresses in the chat box. And then if you do have any additional questions, we'll be able to follow up with the providers or anyone else that are on the call. And then we'll be able to, again, compile all the resources so that everyone can have that as well.
Very good. Excellent. Excellent.
But thank you.
We have a reminder about the evaluation as well.
Yes, yes.
Yeah, thank you, Athena.
Yes. I actually sent an email to everyone who registered, and I put the evaluation in there, the evaluations there on the chat list, which is really, really important. So I think we have something to think about, as Representative Becker just said. If $1 million is out there, and granted it's just supplemental at this point, what is the best way to be able to help the community? And we need to think about that. If I would just to list what people have shared so far, they really want to keep recovery support services working, keep communication and support going, recovery coaching, harm reduction, please continue the telemedicine, support for increased internet capacity, because we've been hearing over and over, especially in Franklin County, it's all, I was going to say blue band, but it is broadband. And we want to go beyond that, and more access to charging stations, quality shelter support that has more meaning to it, with access to sanitation, keep insurance requirements with their authorizations at a minimum, and support for people to know their rights. Need to increase residential treatment, which is really important, but keep the community safe. And we want structured and safe housing, as well as support for access to recovery with technical assistance for co-occurring disorders, and keeping interagency agreement with Mass Rehab and BSAS. What that means is Mass Rehab and BSAS have an agreement that Mass Rehab, BSAS will be able to fund some dollars over to Mass Rehab so that people can continue on in a healthy way to become licensed alcohol and drug counselors. Does that sound good? Also, I see Tracy Minio over there from the Western Mass Substance Addiction Providers Association. How do you do? And
hello, Mary Ann. Thank you. Thank you. And I just wanted to say that I wanted to thank Ruth Jacobson Hardy for facilitating a Zoom meeting for providers on Friday. And we'll be having another one in June. So I'm really hoping that people will be able to join. And it was very nice for Connie Peters to drop in on that Zoom meeting. And it's always good to hear what Connie has to say. So please look for your invitations. Please join us. It's so easy to get disconnected at this time. And it was really great to see some faces last Friday. So stay well, stay healthy, and thank you.
Absolutely, absolutely. Thank you so much in a great big way. I also, is Liz White not still on the call? I feel bad we didn't hear from Tapestry. We heard a wealth of information today. And we have our MOAR meeting tomorrow. It is at 5:30 p.m. There is a Zoom link out for it. So we can be talking about everything that we heard today and put it into a nice little ABCD. I want to thank all the community coalitions for listing their information in the chat box. And I so wish that we had a chance to hear from you. We'll have to do another meeting with just the community coalitions, right? So perfect. And thank you to Magda and Alison for your wonderful graciousness of inviting us, be visible, vocal, and valuable on Hampton County Addiction Task Force time. And also a shout out and thank you to Learn to Cope for supporting us in a big way, and Barbara Gallo for the Western Mass Parent Support. Anyone else? I'm sure there is. Very good.
Great. Thank you very much, everyone. Have a wonderful day. This was a wonderful policy forum. We appreciate your support.
Absolutely.
Yep. We thank you. Thank you so much.
Yes.
Thank you so much for being on the call.
Marianne?
Excellent.
Who was that?
Julie. I just want to let everybody know that in the link, we have a link to the Springfield Peer Recovery Center's SWAY calendar, and there's a link on it for tomorrow's meeting, so you guys can just jump on.
We are just linking our way through life these days.
I know.
Thank you so much, Julie.
You're welcome.
Perfect. Thank you, everybody. Good. Oh, 31 new messages. Wow. We will put them in and we'll send them out to everybody. No, we're going to put this into a movie. We've got it all recorded. Thanks so much. Bye-bye.